For Suncoast News, we're here for you.
With more doctors adopting electronic medical records in order to get reimbursed for their services, many patients are finding that their interactions with their doctor have become more confusing. Patients are often given these printed out information sheets as an alternative to one-on-one instruction from their doctor. And here to talk about what that means for you as the patient is Dr. Dean Sutherland. Thanks for being with us this morning. Okay, so first of all, electronic records, there are some benefits. Talk about those, first of all.
With electronic medical record systems, patients can get their information either given to them personally on a little drive or on a CD, or they can get them sent electronically to other doctors or other hospitals. So hopefully in the future it'll be very easy so that everybody knows exactly what medication someone's on, what their allergies are, what their past problems are, their surgeries. So really that's the goal, and it's going to work out that way eventually. But
it's taking some time to get there. And talk about some of the hurdles for doctors and for you guys, that there's a lot you have to click through in those systems.
Right. So the High-Tech Act, which actually was passed in 2009, requires us to adopt these EHR programs in order to get paid by Medicare and Medicaid. So along the line, there's these little bullet points we have to make, and such things as stopping smoking, checking your body mass index or your weight. Are you diabetic, and do you need diabetic counseling? So a lot of those things that don't really apply necessarily to specialists. Specialists even still have to go click off those things.
Oh, okay.
So what they do along the way, in order to avoid having to talk about to patients directly and spend time doing that, if you click one box, you get to print out 5 pages about stopping smoking, and then you can hand it to a patient. Well, there's a new study that shows that that doesn't really work.
Okay.
You're just handing a patient information as opposed to sitting down and doing the old doctor thing where you actually talk to someone. That doesn't work as well. So this study, they looked at women who were trying to feed their children, and what actually worked in sitting down and talking to the mothers face to face about how to feed their children best. It works much better than handing them a
sheet of paper. They might not even read it.
Yeah.
So what do you suggest as if a patient's going in to see their doctor? How do they maximize that short experience they have there in the office?
You should always write down your questions before you get in there, if you can remember to do that. And it's so much better because you get in there, you have a small amount of time, and people always forget what they want to ask. So write down your questions and make sure they're answered before your doctor leaves.
And what are some of the benefits, though, for doctors, especially maybe general physicians, reminding people of those lifestyle factors?
Well, we know that eventually, hopefully, it's going to have a huge impact. Just the fact that less people smoke, as a doctor, I see a lot less patients with chronic lung diseases and lung cancer. So that's already had a huge impact. And so we're sure that weight reduction and diabetes control down the line is really going to help in the same way.
So it's helpful for them to remind patients, but probably we're speaking to each other instead of printing it off.
Right, and it's tough in a 15-minute time block to do that, and then we have to document everything into these systems. So it's really important for patients to be good consumers and to know what they're looking for.
So understand that you guys behind the scenes have a lot of things to input into those systems. So just be patient.
And by January, all doctors that are accepting Medicare and Medicaid have to have one of those systems in place, or they get penalized.
Okay, so expect a few changes possibly at your office. Okay, well, thanks for being with us. And now let's head over to Chuck, take a look at our roadways.
Thanks, Ellie. Morning.